The New York Post, Betsy McCauley. A man holds a sign at the Exempt American for Obamacare rally on September 10, 2013. That's the photo in the article. And they're protesting Obamacare. The Tea Party Patriots and other groups last week on the Capitol steps. So she writes, are you sexually active? If so, with one partner, multiple partners, or same-sex partners? Be ready to answer those questions and more the next time you go to the doctor, whether it's the dermatologist or the cardiologist, and no matter if the questions are unrelated to why you're seeking medical help. And you can thank the Obama health law. That's funny. Obama didn't say this today. This is nasty business, says New York cardiologist Dr. Adam Budzikowski. He called the sex questions insensitive, stupid, very intrusive. He couldn't think of an occasion when a cardiologist would need such information, but he knows he'll be pushed to ask for it. The president's so-called reforms aim to turn doctors into government agents, pressuring them financially to ask questions they consider inappropriate and unnecessary, and to violate their Hippocratic oath to keep patients' records confidential. Funny, he didn't say that today either. Embarrassing though it may be, you confide things to a doctor you wouldn't tell anyone else, but this is entirely different. Doctors and hospitals who don't comply, listen, with the federal government's electronic health records requirements, forego incentive payments now. Starting in 2015, they'll face financial penalties from Medicare and Medicaid, and the Department of Health and Human Services has already paid out over $12.7 billion for these incentives. Lack of confidentiality is what concerned the New York Civil Liberties Union in a 2012 report. Electronic medical records have enormous benefits, but with one click of a mouse, every piece of information a patient's record, including the social history, is transmitted, disclosing too much. These social history questions also include whether you've ever used drugs, including IV drugs. As the NYCLU cautioned, revealing a patient's past drug problem, even if it was a decade ago, risks stigma. Oh, good Lord. But don't worry, Obama says, look, Obamacare, millions more people are going to have medical coverage. Lie. Hey, if you like your health insurance, you get to keep it. Lie. You'll save $2,500 on your policies. Lie. It'll help balance the budget. Lie. And now to boot, all your privacy rights out the window. Isn't that amazing? I wonder what Bill Clinton will say when his doctor asks him about his sexual activity. I need the long form for that one. Except when it comes to Hillary, then he needs the short form.